the family are all, please permit me to stand on existing protocols. I'm really glad for this mid-morning, almost afternoon, and as the political head of the ministry, Deputy Minister of Health 1, I bring you greetings from the leadership of the country, His Excellency the President, retired Brigadier Dr. Julius Badaview, we in support for human capital development, including the health sector, is unwavering, and we care a lot about the welfare of people in this country, including the one the way the diabetes will likely or not already affect. And also bring you greetings for the leadership of the Minister of Health, who will be at the control of the health of this country. And today again, I will address the young people in force, but because we get international audience and I don't get a prepared speech, we are known for disappointing the one we pay so much into them. Again, greetings to all my mind that you already there this morning. And indeed, diabetes, we already hear from the Master Sami people say it affects a lot of people there. And so, we as a ministry will take them very seriously, and then we get the Directorate of Non-Communicable Disease, we get development partners, the way they support you, the people like Salome, we along for many years, we work on this country and diasporas, where they continue the initiative, and for Professor Russell. And indeed, standing here and bringing a lot of men, young brother Professor Russell to the left. You know, we are all part of the College of Medicine and we are very proud. And for you, the younger ones, this should be a source of inspiration for you. That if you work hard, the students and everybody will be beautiful nurses, and if you work hard, you always achieve the highest level. Because most of we sitting, we're sitting here already, standing here. When I look across that road to see how far me and my brother don't come, there was a very wonderful restaurant with the there. You know, and it was very expensive restaurant, me and my brother at the college. Just across the road was the whole one. Back of me and I don't be going students because action. And looking across the road, a lot of them will say, no matter how humble beginning you get, always have the focus. Always look at the bigger picture. Today, we are into professor, associate professor, Dean of the Clinical Sciences, Deputy Minister 1, Chief Medical Officer, Deputy Clinicals, and all of you are doing a good position tomorrow. And when I say we had a wonderful restaurant across that road, we know what we mean. As students, we know where the wonderful restaurant was coming from. So it's indeed wonderful that that same building they work with you. So those are the ones that used to feel those days. Now they are looking at me with source of pride and achievement that indeed they were all part of the story. So I'm really happy again to be here. And then for the international audience, we follow all of us with what we do. We will address them shortly. So again, ladies and gentlemen, allow me to change, allow me for that change language small. I'll come back to that. It is really a great honor standing here this morning to address you all regarding diabetes. This year, our theme is diabetes and the family, which means that diabetes affects not only at individual levels, it goes well beyond that, affects families as a whole. And we know that in low and middle income countries, we are changing our way of life to the westernized ways of life, which means non-communicable diseases that never used to be part of our culture, we now have to grapple with it. It is the expanding way of life that the urban way of life is overtaking the rural ways. When we are at home, sometimes we have to walk to class when there is no bus. We took pride in it. I went to school as a 10 months and we walked all the way to Auckland when there is no transport. So those silent things we do are what may have helped us in the past to make sure that we overcome diabetes. But this year, as I say, our theme of diabetes and the family resonates very well with the Ministry of Health because we look at health from a holistic perspective. Not only at individual levels, we look at it from that level that from conception to senior citizen, we look at all factors that affect the life of the individual, including non-communicable disease, especially hypertension and diabetes. And so, talking about the family really resonates well with our vision, the Ministry of Health, that life state model. And in Sierra Leone, the burden of diabetes is significant. It is significant. but we have not yet assigned numbers to it at a national level. And this is something very worrying for us at the Ministry of Health. Worrying because we have a plan to make sure we have a national zero prevalence for diabetes in this country. We started some in Kwenadu those days, but I think the non-communicable disease, we are charged with the responsibility now. We have a national strategic plan, and trust us, we are going to get to the bottom of that to make sure that we have a national zero prevalence for diabetes. And Professor Russell, over to you, sir, and all the researchers in this country to make sure that we do. And when we have the magnitude of the problem, then we can mount a more sustainable response. We appreciate what is going on, but as a Minister of Health, I think we need to do that to make sure that we have, like we're doing for the communicable disease of virtual virus, etc. We need to have a comprehensive response to this so that we can work with it. Today, we are conducting free diabetes and hypertension screening across the country, not only in the hospitals, all of there. Across the country in several communities, extending our outreach to as many people as possible. And the community engagement with outreach services is very essential, because that is where you can actually reach the last mile, reach people who are affected by diabetes. Most of us have been doing this for 30 years all over the Sub-Saharan Africa continent, taking help to the people. And so I applaud the Minister of Health, Professor Russell, Dr. Senesie, and all the partners that are working on this to make sure that we really take the services to the people. And you can see that our mobile health clinic Boston is there. We want to use this as one of the tools to engage our community on a deeper level. And this effort is not just about numbers, it is about empowering individuals with knowledge about their health, encouraging them to take proactive steps and offering early diagnosis and support. It is essential that everyone knows their health systems, as early detection can make all the difference in managing diabetes effectively. And knowledge is really, really essential for you to have that force for a change. You know, when you have information really like you afford us here today, culturally adapted, regionally improve on our maternal mortality. You know, we stand very proud to say that our maternal mortality has gone down by almost 73%. In the early 2014-2015, it was well over 1,000 or 100,000 live births. But I stand here today with evidence that we are about 300 or 100,000 live births. We are not yet done. By the end of 2025, we may be 70. And trust us, we have a charge. We have a marching order that by 2038, there should be zero maternal mortality in this country. And all of you here, we need your support to make sure that we achieve this resounding success that we are all aspiring for. We're doing for it, therefore we are going to make sure we do it. And our goal is to ensure that every woman has access to the care she needs to have a safe pregnancy, and that every child born in Sierra Leone is given the highest possible start in life. Ladies and gentlemen, none of this achievement will be possible without the support of our development partners. On behalf of the Minister of Health, once again I extend my sincere thanks and appreciation for all of you development partners and key players in this fight against improving the health care of our people in Sierra Leone, especially in the area of non-communicable disease, but more so diabetes and hypertension. However, our work is not far from over. Let today, World Diabetes Day, serve as a reminder of the importance of raising awareness, promoting healthy lifestyles, and ensuring access to screening and treatment. And as we say, we live by example. That's why we are able to adopt one person at a time to make sure that we will adopt the entire country to make sure we free them from this non-communicable disease of diabetes, from the primary levels of prevention, secondary levels and tertiary levels of prevention. As we move forward, let us carry on this vision with us. Let us ensure that diabetes does not define our future, and that every person living with this disease has access to the resources they need. Let us remember that together we are stronger, and together we can make a difference in this world. As the Minister of Health, again, we continue to advocate, and we are very deliberate to improve the quality of life of people in this country by having more infrastructure, more human resource management, more supply chain management, and also for diagnostic. So on that note, I thank you for all of you for joining us today, and I wish you a successful day, and thank you very much.
Thank you very much, Honorable Minister. I think it deserves another round of applause, please. Thank you very much for really expressing government's and Ministry of Health's commitment in addressing this issue. We thank you for that.